Public health experts say there could be as many as 7,000 COVID-19 carriers in Taiwan right now. Some will never show symptoms of the disease, but could still pass it to others. Some will develop symptoms after the incubation period, which averages to 5 or 6 days. Experts warn that the government must develop ways to catch carriers before they present symptoms, because such carriers are still highly contagious.
It's caught experts off guard by how easily it spreads. The virus' average incubation period is believed to be 5 to 6 days. But a Hokkaido University study found that secondary patients are infected an average of 3.4 days after the first. Researchers concluded that at least half of secondary patients were infected while the first patient was showing no symptoms.
The so-called incubation period averages out to 5 or 6 days. 3.4 days is shorter than 5 or 6 days. So their conclusion is that a certain amount of infections happen during the incubation period.
According to media reports, 7,515 people had traveled from Wuhan to Taiwan between January 10th and 22nd prior to the city's lockdown. Based on the R0 and mortality rate of COVID-19, experts estimate that 505 of those arrivals were virus carriers. Fever screening would have caught only 78% of the carriers, meaning 111 cases had gone undetected. Experts say Taiwan currently has some 7,000 carriers, based on the number of arrivals from all epidemic areas between January 15th and February 15th.
If we don't improve our epidemic prevention measures, if we continue using only our current fever screening system, there could be 7,000 virus carriers in the community right now. That is why we're worrying about the possibility of widespread community transmission.
Experts emphasize the need to tighten COVID-19 screening to catch latent patients and contain the virus before an outbreak.